In the EMANATE trial, we evaluated anticoagulation naive patients. So it's important to define what that meant. These were patients that prior to randomization into EMANATE received less than 48 hours of anticoagulation. And in fact, 61% received no anticoagulation prior to entry into the trial. And the design of the trial was to take those patients, randomize them to apixaban or heparin VKA. And there were two things that we were particularly interested in. One is we gave the clinicians at the site the option that if they wanted to expedite the cardioversion, and the patient was randomized to apixaban, that they could use a loading dose of apixaban. And this was done in approximately 340 patients. And the outcome of that patient group was quite good, in that there were no strokes, there was only one bleed, and one patient died. So we were quite pleased with the outcome. The other area of interest was to evaluate imaging in conjunction with cardioversion. And as far as the imaging data was concerned, there were 61 patients that had thrombi identified at the local site by the local investigator. Those patients continued on their assigned therapy, and at approximately 37 days, approximately 50% of the thrombi resolved. So we have to think about that data, and it's certainly interesting to pursue that further.